Name is SAROJ and my student ID is 20629377. Today, I'll be presenting the assessment and management of Mrs. Teresita Manalo, who has suffered an embolic stroke. This presentation will cover A to G assessment, 4 high priority nursing interventions, and key nursing considerations for 3 medications, which are alteplase, heparin, and metoprolol. Excuse me, please. At first, let's start with A to G assessment, which begins with airway. The airway of Mrs. Manalo is patent at present, yet her reduced level of conscious, where her GCS is 12 out of 15, as well as slurred speech, increases the risk of airway obstruction or aspiration. The nurse is supposed to place her in a semi-polar position and have suctioning equipment ready. According to Porter et al. 2023, maintaining a clear airway is always a priority, as inadequate oxygenation can worsen neurological injury. Sorry. Next, breathing. Her respiratory rate is 26 breaths per minute. The nature of her respiration is shallow and her SpO2 is 95% on oxygen through Hudson marks at 6 liters per minute, which indicates slightly respiratory distress. The objective is to keep the oxygen saturation more than 95% as it is suggested by the Stroke Foundation 2022. Constant presence of more effort or aspiration needs to be monitored as stroke may compromise the swallowing reflex. Next one is circulation. Her heart rate is 132 beats per minute, irregular typical of AF, and blood pressure at 170 over 95 mmF Hg. Elevated blood pressure after a stroke helps to maintain adequate blood flow to the brain and prevents further ischemic injury. It should, however, be carefully observed to avoid intracranial bleeding. She is on heparin infusion, and thus any indication of bleeding like bruising, hematuria, or hypotension should be reported. According to Boldoff et al. 2023, IV fluids are to be kept at to keep vein open rate to prevent fluid overload. Next, disability. Her GCS is 12, neurologically with weakness on left side, facial drop, and slurred speech, which is in accordance with the right-sided embolic stroke. There should be an hourly neurological observations, which includes GCS, pupil reactions, and the movement of the limbs. Reduction of GCS by 2 or above should be reported immediately for medical attention. The fast instrument is also positive to stroke diagnosis with left arm weakness, the speech problem supported by Stroke Foundation 2022. The next one is exposure. She is febrile, has no injuries or hemorrhage, no wounds or bleedings noted. IVC instituted at left cubital fossa, and she is peripherally cool. Next one is fluid. She is on compound sodium lactate, also known as Hartmann's fluid, by IVC located at left cubital fossa at the rate of 20 milliliter per hour to keep her vein open. Next one is glucose. She is non-diabetic and her last checked glucose level was 5.5 millimole per liter. This is all for A to G assessment. So let's jump into high priority nursing interventions. At first, we have to ensure her airway and oxygenation. Secondary brain injury from hypoxia can be prevented by maintaining a clear airway and providing adequate oxygenation. Placing the patient at semi-upright position and administering supplemental oxygen and continuously monitoring their SpO2 level. In case of any oral intake, aspiration precaution must be taken as per Stroke Foundation 2022. Second one is observation of neurological status. According to Briney et al. 2011, nurse needs to perform regular neurological assessment including GCS and pupil reactions to detect early signs of deterioration. The third one is to manage hemodynamics. Nurses should keep patients' systolic blood pressure within the targeted range and avoid sudden drops unless it is over 220 mmF Hg or instructed by a doctor. Stable blood pressure helps to maintain good blood flow to the brain. According to Boudolf et al. 2023, the patient should be under continuous cardiac monitoring since AF could lead to embolism. The fourth one is to arrange and provide support to thrombolytic therapy. Early administration of thrombolytic therapies such as alteplase within 4.5 hours of stroke symptom onset significantly improves patient outcomes by restoring cerebral blood flow and reducing long-term disability. Nursing responsibilities include verifying the result of neuroimaging to rule out hemorrhagic stress, assessing patients' eligibility for thrombolysis, ensuring prompt and secure IV access, monitoring vital signs and neurological status during infusion, and providing emotional support to the patients and family throughout the procedure as per New South Wales Health 2023. All right. Finally, let's talk about the medication and the nursing considerations. To begin with, we have IV LTPase. IV LTPase should be administered within 4.5 hours of stroke onset after confirming the absence of intracranial hemorrhage by CT scan. Nurses must Nurses must monitor vital signs and neurological status closely during and after the IV infusion. The main adverse effect is bleeding, particularly intercerebral hemorrhage, indicated by sudden headache, vomiting, or neurological changes, as per MIMS Australia 2023. Next one is heparin induced infusion. Heparin IV infusion. Heparin IV infusion requires monitoring of APTT and platelets levels before and during treatment. It should be administered using an infusion pump with the dose and rate double checked by another nurse. Nurses should avoid IM injections and unnecessary venipuncture and closely observe for bleeding or signs of heparin induced thrombocytopenia, as per MIMS Australia 2022. Third one is metoprolol 50 mg BD. Okay. Metoprolol 50 mg BD should be given with food to reduce gastric irritations, and tablets must not be crushed if sustained release. Nurses should assess heart rate and blood pressure before administration and withhold the dose if the heart rate is below 60 beats per minute or systolic blood pressure is under 100 mmHg. Common side effects include bradycardia, fatigue, dizziness, and orthostatic hypotension. So patients will be advised to rise slowly as per MIMS Australia 2024. These medications require close monitoring and understanding of their interactions, particularly when combined with anticoagulants and antihypertensives in a post-stroke patients. In conclusion, Mrs. Monolo's case highlights how a systematic A to G assessment helps healthcare providers quickly identify patients who need urgent care and prioritize treatment from the very first stage. The importance of nursing interventions is to sustain airway and oxygenation, check the neurological status, address hemodynamics, and thrombolysis preparation. Safe and effective use of medication, especially alteplase, heparin, and metoprolol, involves careful assessment, follow-up, and management of clinical protocols. Nurse can play an important role in optimizing recovery and avoiding complications in the management of embolic stroke using evidence-based nursing practice, early intervention, and collaboration with multidisciplinary team. Here is my reference list. Thank you. This is all for today.